Our next section is on consent issues. Do not resuscitate orders, physician-assisted suicide, euthanasia, terminal sedation. What does it mean, the law of double effect? Futile care, and what about issues of tissue and organ donation? Only adults can consent to procedures, period. Each procedure needs individual consent. You can't extrapolate consent for one procedure into another one, even if the patient is unconscious. Consent is automatically implied in emergencies, which you would want it to. What if you got hit in the head and knocked unconscious and needed emergency surgery? Would you like it if somebody didn't do that for you and then you were brain damaged? You go, why didn't you operate? And they go, well, you weren't awake to give consent. Like, yeah, well, why don't you take care of me? Also, the person doing the procedure must obtain the consent because it's the only way to know that the person has been fully informed. Adverse effects of procedures must be explained to make a consent valid. You can't say to someone, hi, we want to do cardiac cath. Okay, no problem. You have to say, we want to do cardiac catheterization, and it can cause a hematoma at the entry site. You have to explain the adverse effects to make the consent valid. The consequences of refusing a procedure must also be explained. You can't say to someone, we need to do cardiac surgery, and they go, I don't want that. Okay, fine. You have to say, we need to do cardiac surgery because if you don't get it, you're going to die. Oh, okay, changed my mind. Pregnant women can refuse procedures and treatments for their unborn children. Now, I want to emphasize that we're not here to give you anybody's personal opinion. In this section, you do not have to agree with what I tell you. You just have to answer it on the test. Telephone consent is valid. For instance, a person has lost capacity. They're on a plane flight and in another state. The proxy is in another state. That person has to be able to give consent over the phone, by telephone, in order to have the right procedure done. It's valid. A patient signed consent for ovarian biopsy on the left side. At surgery, you find cancer on the right side. What do you do? What are you going to do? Well, you got to wake the person up and obtain consent to remove the ovary on the right side. If a person signs consent for one procedure, you can't extrapolate it to the other, even if it seems as easy and straightforward as this one. You said, I only signed consent for a procedure on one side. What happened? Hey, I woke up and you took out the organ on the other side? Who told you you could do that? A patient needs colonoscopy, and the gastroenterologist asks you to obtain the consent for procedure. This is very common in the hospital. Hi, I'm over the phone. Listen, Dr. Intern, can you get up there and do consent for the procedure? And the answer is no. The gastroenterologist who will perform the procedure needs to obtain the consent. Do you know all the complications of the procedure and the alternatives? Did you explain to the person that they could perforate? Did you explain to them that they could wait? Did you explain to them that there's barium enema? Did you explain to them that there's an alternate procedure that they can do? If you don't explain the possibility of perforation because you're unfamiliar with it, the consent isn't valid. If the person's colon perforates and you didn't explain the alternate procedure and document it, I told them that it could perforate and documented it, then the consent isn't valid. Consents are informed consent, and informed consent emphasizes the word informed at the beginning. You have to know the complications of the procedure and the alternative procedures. Do not resuscitate or DNR orders refer only to withholding CPR, which means chest compressions and the cardioversion, shock, epinephrine, and other medications associated with an acute resuscitation. It does not mean that if the person is DNR that you're withholding any other form of therapy. It does not mean that you can't do surgery. It does not even mean that you can't get chemotherapy. It simply means that if the person dies, you don't resuscitate them. A patient with capacity consents to DNR before losing consciousness. She needs a surgical procedure, but the surgeon refuses because the patient's DNR. What do you do? Well, this is a very common circumstance. Surgeons don't like to operate on DNR patients because they don't want someone to die on the table and then not be able to resuscitate them. However, they may not like it, but you perform the surgery. The surgery needs to be performed. DNR doesn't mean withholding antibiotics, chemotherapy, or surgery. DNR means only that if the patient dies, you won't attempt resuscitation. Now, you may very well be on your surgical rotation right now as you're preparing for step 2, and you might have seen within the hour that you saw just before you snuck into a call room to study for step 2 that the surgical attending said, reverse the DNR and I'll do the surgery. He's wrong. So for your rotation, answer what your attending tells you to. But for your test, just remember, DNR doesn't mean you can't have surgery. Physician-assisted suicide is always a wrong answer. Always. This includes states in which it's legal. The ethical requirements for a physician supersede legality. You can agree in your heart with physician-assisted suicide, but don't answer it. They're going to always couch it in a question where it says it's in Oregon or Washington state where physician-assisted suicide is legal. They're going to couch it in something that says, oh, the patient's in pain or metastatic cancer, and especially it's going to say you have no personal objection to physician-assisted suicide. It's still wrong. It's still considered incorrect. Physician-assisted suicide is administered by the patient, but is still unethical for the physician. So what do you do when it says something is legal, but it's considered unethical? The answer is, our ethics beat legality. Physician ethics come before legal requirements. You cannot do something unethical, even if it's legal at the moment. Lots of things have been legal over the course of history, but they were not necessarily ethical. Euthanasia means that the physician administers the treatment intended to end or shorten a patient's life. That key word is intended to end life. It's always wrong. Physician-assisted suicide is the physician provides it to the patient gives it to themselves. Euthanasia means the physician does it to them. It's kind of like the difference between selling you a gun and shooting you. Those are wrong. At least shooting you is wrong. Well, how does this fit in with the issue of terminal sedation and quote-unquote law of double effect? The term double effect means this. Is it acceptable to administer pain medication even if there's the possibility that the treatment may shorten life? For example, is it acceptable to give pain medications to a person with COPD, with emphysema, who has metastatic cancer, if the only way to relieve the pain is to give enough opiates that breathing may be impaired and causing the patient to die earlier? And the answer is yes. You can, definitely. Relieving pain beats the adverse effects. It's one of intent. That's why we emphasized before that euthanasia is I'm giving you this medication with the intent of ending your life. Well, there's two guys down the block that both have knives. One walks up to you and cuts you and says, I'm stealing your money, and takes your money. The other one walks up to you and cuts you and his insurance reimburses him. Well, the other one's called a surgeon. Well, there are two people that stab another guy. Well, the one has intent. If you're doing it with the intent to relieve pain and as an adverse effect it shortens life, it's ethical. If the primary intent is to shorten life, it's unethical. It can be very difficult to define what futile care means. A physician is simply not obligated to render care that's futile, even if the family or the patient wants it. This is a very big deal. It means that you're not a vending machine. This is very hard for physicians, very hard. If the physician believes that intubation or dialysis is just not going to help, it's difficult not to bow down to that pressure. The answer is to say no, though. If the patient is brain dead and the family insists on continued mechanical ventilation, you certainly are under no obligation to do so. As a matter of fact, you're more under an obligation to stop it. You're under no obligation to perform tests and treatments you consider worthless. That is, even if the patient will sign consent. A person can't walk up and says, listen, I want to sign consent for you to remove my left pinky finger. I'm an adult with capacity. I will pay for it, and I accept the complications of the procedure. And the answer is no. 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 Organ and tissue donation. Payment for organs is unacceptable. Payment for renewable tissues like sperm and eggs is acceptable. That's the current ethical value. That's it. Now, you may not agree with it. Doesn't matter. That's the rules. Consent for organ donation is rather particular in terms of only the organ donor network should be asking for consent for organs. This is both to protect the supply of organs and to protect the interests of the patient and to protect the physician as well. There's an ethical conflict of interest for a physician to ask for consent for organ donation. For instance, you can't say, I'm taking care of your loved one, but at the same time be saying, by the way, I'd like to be able to take their organs too. I'm sorry, your mother is sick. Mind if we take her lungs when she dies? The organ donor network has fewer refusals than the physician, and there's no ethical conflict of interest. Organ donor cards give an indication of the patient's wishes, but the family can still refuse organ donation, even if the person has an organ donor card. Now you might say, what's the point of the organ donor card? Well, it is to give an indication of what the person wanted with their own organs after they die. However, remember, ultimately, once the person is dead, the body becomes a piece of property. Therefore, as such, the family can come in and can intervene. However, if there's no family refusal, the organ donor card should be enough to indicate the person wanted and will successfully be able to donate their organs